Well, good morning, everyone, and let me begin by thanking Dr. Stephen Safyer and the team here at the Montefiore Medical Center for their hosting us today, and most importantly for their commitment to the health and well-being of fellow New Yorkers. They have been real crusaders, real leaders in combating the obesity crisis in our city, a crisis that is particularly serious here in the Bronx. Now, the good news is that that the awareness of this problem is growing, and so is the moment for tackling it. And as we speak, many of you know First Lady Michelle Obama and Walt Disney CEO Robert Iger are announcing that Disney will no longer air ads aimed at children for products that contain large amounts of fat, sugar, or sodium. And that really is encouraging, and hopefully Disney will start a trend. But we can't sit back and wait for others to act. We have to take responsibility for the problem and take action ourselves. This is a health issue that hits close to home for so many Americans. Nearly all of us have struggled to maintain a healthy weight or know someone who has. And I can tell you from personal experience, particularly as you get older, it is a struggle. Eating a healthy, balanced diet, finding time to exercise, and maintaining the commitment to both, not for a few months or years, but throughout one's life, is a real challenge. And if you lose the weight only to gain it back, you get discouraged and lose hope. And our administration is saying to every New Yorker, you are not alone. We are absolutely committed to doing everything in our power to help you get on track and stay on track to maintain a healthy lifestyle. Because this isn't your crisis alone, it is a crisis for our city and our entire country. Let me just give you a few facts to see how serious this crisis really is. 58% of New Yorkers citywide are overweight or obese. In the Bronx, it is 70%. That is 630,000 Bronx residents who are at greater risk of developing a host of diseases and conditions, including type 2 diabetes, cancer, hypertension, heart disease, kidney disease, liver disease, joint problems, and blindness. Of course, obesity doesn't just affect adults. Among New York City public school students, nearly 40% are overweight or obese. Each faces a higher risk of developing all the diseases that I mentioned, and tragically, each also faces a greater risk of early death. In fact, obesity is the second leading cause, just after smoking, of preventable death in our city. An estimated 5,800 New Yorkers die each year because they are overweight or obese. Now, for decades, smoking was seen as an intractable problem and one too big for local government to address. But over the past decade, smoking among adult New Yorkers has dropped 35%, resulting in more than 450,000 fewer smokers in our city. And estimates tell us that means 50,000 fewer smoking-related deaths by the year 2052. Our success in cutting smoking deaths to record lows shows that we can tackle the toughest public health problems head-on and make a huge difference, but only if we are willing to act boldly and to target the problem comprehensively. And that's what our administration has done with smoking, and that's what we are doing with obesity. We're confronting the obesity epidemic on several fronts. That includes our most recent proposal to curb consumption of sugary beverages. Sugary drink consumption is a key driver of the obesity epidemic in the United States. In fact, we get more excess calories from sodas and other sugary beverages than from any other single source. What's worse, these are empty calories that flood our bodies with sugar without making us feel full. Many New Yorkers don't realize that a 20-ounce soda has the equivalent of 16 packs of sugar. And that's why we are combining our new reform limiting the serving size of sugary drinks with an expanding public education campaign. It builds on the work we've already done to give New Yorkers more information, like calorie counts in restaurants, so that they can make better choices about the food they and their families consume. We've also provided New Yorkers with healthier options, including creating healthy bucks that can be used to purchase fruits and vegetables at farmers markets, and making hundreds of green carts available across the city that families have more access to fresh produce. And if you walked in and you noticed, there was one right outside today with a number of people standing there buying stuff. In addition to the tragic human toll, Obesity is also placing a growing burden on public finances. People say, why should I care about this? I'm not overweight. Well, obesity costs New York City alone roughly $4 billion each year. Nationwide, that number is $150 billion each year, and the crisis is only getting worse. Hospitals like Montefiore have realized that we simply can't treat the effects of obesity. We must help people change their lives before they ever need to enter a hospital. Montefiore has made providing their employees, patients, and visitors better access to health foods a priority. They're also educating children and their parents to make healthier food choices, and partnering with local groups to host farmers markets and with the city to offer exercise programs and cooking classes. Now, we'll be working with a range of partners throughout New York to do even more. As the report we released on Thursday detailed, our administration refuses to stand on the sidelines while millions of our fellow New Yorkers struggle with the health implications of being overweight or obese. And I want to thank Deputy Mayor for Health and Human Services Linda Gibbs, Health and Hospitals Corporation President Ellen Aviles, Department of Environmental Protection Commissioner Carter Strickland, Food Policy Coordinator Kim Kessler, and Department of Education Deputy Chancellor for Operations Kathleen Grimm, who are with us today and serve on our administration's Obesity Task Force, as well as the Deputy Mayor for Operations Kaz Holloway and Schools Chancellor Dennis Walcott for their leadership in addressing this crisis.